Hello, friends. It is another read aloud time. This week, the community helpers that we are going to be talking about are doctors. This book is called Hooray for Doctors. Doctors care for patients. Doctors work in hospitals and clinics. They keep patients healthy. They help patients who are sick or hurt. Let's see, there's the doctor. And here's his patient. She might be sick, or sometimes you can even go to the doctors when you're not sick, when you're well, just to make sure everything is going okay. Doctors work with nurses. They treat patients together. There's some doctors and nurses. They're working together to come up with ideas of how to best help their patients. There are many kinds of doctors. Some doctors help new mothers. Others fix broken bones. Oh, it looks like this girl might have broken her leg. Have you ever broken a bone before? What is something that you wear when you break something? Well, I know when my son broke his leg, he had to wear a cast on his leg. It's like this hard white shell that you put on the broken bone so you don't move it and the bone can heal. Many doctors wear white coats. They may wear face masks. These protect them from germs. You can see this doctor, she's wearing her white lab coat. She has this right here that's called a stethoscope, so she can listen to your heart and make sure it's pumping correctly. And then here's her face mask to protect her from germs. I know many of you have probably worn face masks to help you from not getting sick and protect you from germs, maybe when you go to the store. And the doctors wear those all the time when they're treating patients so they don't pass germs to their patients, and then they stay protected from germs as well. Some doctors perform surgeries. They wear scrubs. And these are scrubs. The scrubs are very, very clean so that they don't get the patient dirty with germs, and it also protects the doctor from any germs that might come their way, or any dirtiness, any blood or anything like that might get on them. Doctors use tools. This is a stethoscope. The doctor uses it to listen to a patient's heartbeat. And there's that stethoscope. When you went to the doctors, did the doctor use a stethoscope to listen to your heart? Maybe your doctor even let you listen to her or his heart. What are other tools that a doctor might use? Think about when you go to the doctors. What do they use? Maybe a thermometer to take your temperature. They put it under your tongue and your mouth to see if you have a fever. They might also use a blood pressure cuff, that thing that they wrap around your arm and it squeezes your arm really tight so they can see what your blood pressure is. Doctors ask questions. They decide what a patient needs. This patient needs a shot. And I'm sure you've probably had a shot before. We get shots for our immunizations when we're healthy to make sure that we stay healthy. We also get shots when we're sick, maybe antibiotics that help us get better quicker. Shots hurt just for a minute, but they keep you healthy and safe. So they're very important and they're good for you. Doctors go to school for a long time. Each doctor goes to school for at least 11 years. Why do you think doctors go to school for a long time? Yeah, they need to learn a lot of things about our bodies. They need to make sure that they don't hurt their patients. They want to be very, very smart and know all about different parts of the body so that they can be the most help to their patients. You see, these doctors are probably in school, and this is their teacher showing them the bones in somebody's body. That looks like a spinal cord. If you feel your back, you can feel those bumps in the middle of your back. That's what's in your back, those bones. Doctors work long hours. Some work during the night. They work hard to care for people. There's sick people all the time, especially in the hospital. They're sick all the time, so doctors have to be available at all times of the day, even in the middle of the night, to make sure their patients are doing well. Okay, and here's some of the doctor's tools. We have the stethoscope, which this doctor uses to listen to your heartbeat. We have a face mask that the doctor uses to protect his or herself from germs and protect their patients for germs. And here's the lab coat that the doctor wears. And here's some words that we learned in our book today. We learned about germs. These are germs. You see germs with a microscope. They're very, very small. You can't usually see them, but they're living things, and that's what makes you sick, is when you get some germs in your body. And here's a patient. And a patient is a sick or hurt person who is being treated by a doctor or a nurse. And here we see a stethoscope, which is a tool used to listen to someone's heart or lungs. And then if you see right here, that's surgery. Those doctors are doing surgeries. And surgeries are procedures where doctors open up part of someone's body to fix it. You might have had surgery at some time, or you might know somebody who had surgery. And it's very good that doctors learn about the body so they're able to do surgeries on us, because sometimes the things that are hurt or sick on us are inside our body, and we need doctors that know how to go inside of our body and fix us. Okay, friends, I hope you learned a lot about doctors. These are our community helpers and our friends in the community that help keep us well. I will talk to you soon. Have a great day.